We're live in the right place. Yay. Hello, hello. Good morning, lovely ladies. Oh, it's a bit brisky this morning. I can't believe how cold it actually can be so quickly. It was 4 degrees when I got up to go for my Friday morning walk with my girlfriends, and driving down into the valley into the girlfriend's house. It was like frost, like already. My goodness, it's only May. My fingers are white. All right, so this is our Friday real talk. It's a proper conversation about something that has clearly landed for a lot of women this week. I've certainly had more comments and messages from women on this subject than most of my other subjects, which kind of surprised me because I thought that the insulin resistance, I thought that inflammation, belly fat, I thought that I would have got more interaction from them, but it wasn't. It was all about fatty liver. So, hi, Helen. So yeah, the lot of women, as I said, have been messaging me, and they said that they didn't even know that this was a thing. Right. So some women have said that they've been told they have fatty liver. A couple of them have actually been given a little bit more information, but some women also didn't know that their symptoms could be coming from the liver and not just under the menopause umbrella or term. So talking about terms, one of the first things we need to clear up, there's fatty liver, there's NAFLD, which is, and then there's MASLD, so which really sounds confusing before we even start. And honestly, that confusion is a part of the problem. So one of the biggest things I hear from women is, but I don't drink much. So when women are told that they have a fatty liver, it generally shocks them because they associate liver problems with alcohol. But there's so much more to it than that. There's also, they haven't associated liver health with hormones, with stress, with metabolism, with menopause itself. And that's why I wanted to do this conversation today properly. Well, all this week, really. So first, let's clear up the name, okay? Because the names are changing. They're evolving as we learn things. So some people are told fatty liver, some are told NAFLD, and some are told MASLD. All right. So historically, the term was NAFLD, which is non-alcoholic fatty liver disease. Now the terminology is shifting towards the MASLD, which is the metabolic dysfunction associated steatotic liver disease. A big long name. But essentially, what they're describing is the fat accumulating in the liver that is not primarily caused by alcohol. The reason they changed the name is because we now understand this is very strongly tied to insulin resistance, visceral fat, metabolic dysfunction, inflammation, all the things that I have been covering the last few weeks in this symptom decoder series, and which is why it becomes so common in midlife women. And this is where I really want women to stop blaming themselves, because I see so many women quietly panicking, thinking, oh, I must be eating badly. I've been eating the wrong things. I've ruined my body. I'm lazy. I'm failing. No, your body has changed. And no one explained what that shift actually does underneath the surface. And why midlife? Why midlife are women getting more and more of these changes? And here's the piece that most women are never told. Your liver is also where estrogen is processed, metabolized. and cleared from the body. Your liver has and it's not just estrogen, your liver actually also converts your inactive to active forms of your thyroid hormone. Your liver does a lot of jobs. It's only over 400 jobs that it has, and we think we're busy. Right? When the liver is under load, estrogen doesn't clear efficiently. It recirculates. So AKA becomes or leads to, contributes to estrogen dominance, right? Because it's recirculating. If it's under load from alcohol, from other things, which I'll go through as well, then it sees the estrogen and it says, oh, I made you, you're not a toxin, so you can just go entertain yourself, recirculate for a while I deal with the toxins, right? The things that are really going to cause damage. So when it's under load, that's what it when it's overloaded. And that contributes to hormonal symptoms women are already managing, such as mood swings, such as sleep disruptions, such as weight that won't shift. It's all connected through the same organ. For years, estrogen has been also being quietly protective. It helps with to regulate fat distribution. It helped improve insulin sensitivity, reduce inflammation, and support liver function overall. So when estrogen declines, as we go through midlife, visceral fat increases, inflammation rises, blood sugar regulation changes, stress lands differently, and the liver starts carrying more load. So what are some of the symptoms of fatty liver that women tend to miss? And this is the tricky part. Fatty liver is often called the silent disease because we don't associate those symptoms directly. We're not aware. But I actually think the body whispers for a long time before people listen. And as I say, there's a little tap, becomes a louder knock before it shouts. Okay? So things like fatigue that doesn't make sense, brain fog, stubborn belly weight, 3 a.m. wakings, carb cravings, did I say poor sleep? Feeling heavy or sluggish, bloating, low motivation, even skin changes and puffiness, morning nausea, lack of hunger first thing in the morning. Right? These are all signs of your liver. And underneath all of that, you're a quiet feeling of not being yourself anymore, of watching yourself from a slight distance and not quite recognizing the woman you see. And women often think, oh, I'm just getting older, but these are clues. What else can cause raised liver enzymes if it's not fatty liver disease, if it's not because of the things I've just said? Right? Other things that contribute to, are things like, as Wendy commented, medications, and yes, of course, alcohol, viral infections and viral load, gallbladder issues, autoimmune conditions, thyroid dysfunction, insulin resistance, supplements, and not just medication, but supplements. Remember that your liver has to filter, like all medication that's taken orally has to go through the liver, and so do supplements. So some people taking over-the-counter supplements, taking excess supplements, that can have a contributing factor as well. Chronic inflammation, even rapid weight loss in some cases. This is why the context matters and why we have to take it into consideration and why proper investigations actually matter. So remembering that I did have 18 years plus or minus a bit in diagnostic medical imaging. So I have seen, I've done ultrasound, the sonographer. So I see what the livers can look like, and it's pretty quickly differentiated from other liver diseases. Right? So what are some of the things we can do? What are some of the tips to support your liver? So if you're listening and thinking, okay, what can I actually do? I've just put together 3 tips for you. One is blood sugar stability. Your liver loves that to be stable. Skipping meals, constant snacking, sugar spikes that increase liver load, right? Stop it. We want to stabilize our blood sugar level. So protein, fat, and fiber, balanced meals rhythm. This matters more than perfection, just having that consistency. Tip number 2 is to reduce the overload, right? So we often are juggling a lot of things at this time in life, okay? Stress, poor sleep, inflammation, overcaffeinated, undernourished. Sometimes support is less about doing more and more about reducing the pressure in the system. And so I've been explaining how our body is made up of systems, and when one system is compromised or out of rhythm, the other systems have to take up the load. And tip number 3, support gently, not aggressively. This is where I differ from a lot of detox culture online. I've worked in 2 very, very different detox environments here locally in Byron Bay. One was a juice fasting, yoga, colonics, and the other was intensive addiction therapy program with very high cost protocols. And I've seen what both ends of that spectrum look like in real life in women's bodies. And what I know from that experience, and I'm talking over about 10 years, is that aggressive approaches, particularly in midlife, often stress the system further rather than support it. Your liver doesn't need a shock, right? It needs sustained, gentle reduction in load. And I'm not going to go into the scientific details, because there's also all those detox in a box, all those kits that you can buy over the counter. And of course, there's the detox, retox, right? I don't believe midlife women need aggressive detoxes. We have different phases of, the liver has 3 phases where we need to support each of those phases. Generally, everybody's liver is really good at phase 1, but we get a backlog at phase 2. So if we go into harsh, we're going to what's called deconjugate toxins in the body, in our circulation, but it's got nowhere to go. So now we have radical toxins running through the body because it can't get through the gate. So we need to support each phase of 3 phases to make sure that we break the things down, we repackage them, and we eliminate them. Right? And so I'd love to deep dive because I'm a nerd, but I'm not going to. Just understand that we need to support the liver gently. And that's why I use gentle herbal strategies and the hormesis style support, which I posted about yesterday, to small, consistent nudges instead of shocking the body. And as I commented to somebody else about taking it slowly, what can I do to support my liver? Stop putting more on it. Stop. It's not just, can I take a miracle pill? No, you've got to stop putting the load in there as well as support. Otherwise, you can get very sick very quickly. Nikki, good morning, Nikki. What should you take to help the liver? I think I just answered that. And it does depend. So if you, yes, there are supplements and yes, there's herbs, obviously, but it kind of also depends on what you're detoxing it from. So if you've been eating a lot of, you've been on a holiday, you've been drinking too many cocktails, eating too much rich food, it is very different than if you've been drinking excess alcohol for 20 years, or if you've been on massive doses of medications, or especially chemotherapy, right? There's different approaches depending on the level of toxic shock to the liver, and we've got to, some of those you have to do very, very gently so that you don't release too many toxins into the body at once. So, and I shared a case study this week of a woman in her 60s. She wasn't drinking heavily, she wasn't out of control, but she had fatigue, she had metabolic dysfunction, weight around the middle, fatty liver changes, but over 5 months, right, she reduced waist circumference significantly, which is a very important factor, improved her liver markers, reduced her fatty liver status, and improved her energy, not through extremes and not through punishment, through supporting the body properly. And I think that's the important part. So what are some of the frequently asked questions? As I said, like a lot of information, a lot of communication happening this week. One, can fatty liver be reversed? Yes, particularly early stages. Late stages, we can pause it. We can't always reverse it completely. So this is one of the most reversible metabolic changes or conditions that we see. The earlier you catch it, the better though. Question number 2 that I wrote down, do you have to be overweight to have to be diagnosed? No. Lean women can absolutely develop fatty liver, especially post-menopause. Question 3, if my liver enzymes are normal, am I fine? Actually, no, not necessarily. Some women have normal enzymes and still have fatty liver changes, which is why symptoms, history, waist circumference, and scans can matter too. As I said, having done ultrasounds on hundreds of bodies, it's pretty quickly picked up. Does HRT make it worse? Not necessarily. There's a couple of things in there, right? Because there's HRT patches, right? And then there's oral, and then there's transvaginal. So oral HRT has to go through the liver. Patches don't, they go straight to the bloodstream. So there's that part of the equation, but depending on the form of HRT you're on. And in some women, appropriate HRT may actually be supportive because estrogen itself has that protective metabolic effects. This is where individual assessments matter. And as I said, the form that you're taking it in. Question 5, what about the GLP-1 medications? So that's your, miracle weight loss drug, the Ozempic and Wegovy and things like that. It's quite nuanced, right? They can improve insulin resistance and weight loss, which can help fatty liver, but they are not a replacement for supporting. You can't just take that and not do anything else, right? The GLPs are not going to support your metabolism, your lean muscle mass, your nutrition, your nervous system health, your long-term habits. Otherwise, if you don't do them as well, right, the underlying drivers are still there. So ladies, I think what I really want women to take away from this week is your body is not betraying you, and it's not randomly just failing. It's responding to change, to load, to stress, to metabolic shifts. And once you understand that, you can stop panicking and start responding properly. If you've been listening and thinking, that sounds like me, please don't ignore it. You can comment, Liva, under this video. You can message me privately. You can book a time with me to have a conversation, and we can talk about your picture properly, because this isn't just about generic advice. It's about understanding what your body is asking for. And if you're someone who wants to, you may not have had the tests, but you want to actually see your markers, not just the standard, what's called LFTs, liver function test, that your GP runs, but full metabolic picture. There is what I have introduced, the BioSync Metabolic Review. There was a post, depends where this video sits in the page. There's a post about it that I can certainly tag you in if you're interested in having those tests done yourself. But this isn't about fixing your body, ladies. It's about finally understanding what your body has been trying to tell you. Hope this has answered a few more questions. Hope it's been helpful. Have a lovely, lovely weekend, and I'll see you back here on Monday.